So first of all, let's start with introduction to myself. I'm Arief Mohammad, and I'm a clinical pharmacist currently working in Northern Health Hospital in Melbourne. So I moved to Australia back in 2018, and then I completed my internship in community pharmacy. And after clearing my internship, then I started my journey in the hospitals as a clinical pharmacist here. So I got around almost 6 years of experience here in Australian practice. And meanwhile, the main intention why I started this Ellight Expertise, the platform, is by the time when I was doing my internship, so there were a lot of pharmacy assistants who were working in that pharmacy. It was a big store. It was a very big store, one of the chemist warehouse. It's a very big store in Australia. So there were totally 4 pharmacy assistants were there. Three were Indian guys and one was from Pakistani. So they just approached me how to clear the exam. So we tried the exam and we failed it. So one of them, he failed it 4 times. He did 4 attempts, but he was unsuccessful. And also many of their friends, they also started contacting me, and I started giving the advice to them on weekends whenever I had the time. Then they used to come to my house, and I used to tell them that this is the way that need to prepare and some material and notes and so on. So they have cleared the examination, and then from there, from that stage, they asked me that there were a lot of Indian students who moved to Australia here on student visa, and still they are struggling after masters, that what they need to do. So this is what it happens with all the not only in Australia, wherever the countries that you go all over the world, this is the same situation. So either you go to UK, US, Canada, Australia, Ireland, or whatever the country that is. So after completing the masters, so there will be a dilemma that what we need to do, because after masters, after spending that much huge amount on masters, we can't get any permanent residencies. Okay, so we can't get any job opportunities in our field, like in pharmacy field. We can't get any PR, that is the permanent residency. So that's why it is important for anyone that whoever they are planning to move to overseas and to build their career, then you need to decide that which pathway that you need to select, either to move to any one of these countries and pursue masters, or to be on a safe side option, like clear the licensing examination, and then straight away you can move there and start working as a pharmacist. So I started this Ellight Expertise platform back in 2023. And from each batch, the success ratio that always we maintained above 90%. Okay? So for Australian licensing examinations, and also we started providing the training for Australian intern pharmacists. So more than 100 candidates so far, they are getting the training with us for internship. So 50 of them they have cleared, and now they are fully licensed pharmacists in Australia. And we also started providing the training for Canada PBC examination, where there is a huge demand in Canada. The reason is because clearing that PBC is a bit challenging task. Okay? So if 100 candidates, if they appear, then 30 or 40% they will clear the examination. So it's a bit challenging one for the students to crack that exam. But in case if they clear that exam, then the opportunities will be much better in Canada, because very less candidates, they will pass the examination. So that's why the opportunities will be much better in Canada. And also right now, Ireland is a booming market now for pharmacists. So there are good opportunities in Ireland as well. So we are here to discuss with you guys, what will be the questions that you have, or what will be the queries that you have. So you are just feel free to ask to us, and then we will try our best to answer all your queries. Ashutosh or Ashrita, so just you can get any questions from the candidates, and then you can just let me know.
Yes, sir. We have some questions like, do pharmacists get PR in Australia?
Do pharmacists get PR in Australia?
Yes.
Yeah. As pharmacists, they will get the PR because pharmacists, they come under health professionals. So all the health professionals, like not only Australia, in all the countries, especially post-COVID, so health professionals, they have a high demand. Okay? So definitely they will get the PR. Okay. So but in Australia, like I will clearly explain you what are the steps, like how to get the PR in Australia. So there are different categories of visas in Australia. One is the 491 visa, 190 visa, as well as 482, that is the sponsorship visa. Okay. So 190 is straight away PR. You will get the permanent residency straight away from your home country. For instance, if you are planning from India, then straight away you will get the PR by applying for the 190. If you get the 190 nomination, then you will get the straight away PR. And there is another category, 491. So through 491, at first you need to come to Australia and need to serve in the regional areas, in the remote areas, at least for 3 years, and then you will get the permanent residency. Okay. And there is another option, that is the 482 option. From 482 means one of the employers, they need to give the sponsorship. Okay. That is the employment offer. And then you need to go and work for that employer for 3 years. And after that, you can apply for the PR, permanent residency. And also there is one more option, that is the 407, that is the intern training visa. So you will get 1 year visa, but it can be extended for 2 years as well. So where you can finish your internship and then you can start looking for the job opportunities, and then you can get the sponsorships and you can continue working as a pharmacist here in Australia. So these are the ones that you can try straight away from staying from the home countries. But otherwise, in case if you want to move to Australia first, and then you can, if you want to look at the jobs like by pursuing any courses by here. Okay. So some students, like they have that thing as well, like after clearing this OPRA examination to Australia, at first they want to move to Australia as soon as possible, because getting this PR, permanent residency, it takes some time. Even I can share my like pathway. I did my KAPS examination back in 2016. I cleared my examination and I got my permanent residence visa in 2018. And that too, it was not permanent residence, it is just temporary residence, TR. Okay. So it is known as the TR, it's not the PR. So in 2018, December, I cleared my KAPS examination in October 2016. And in December 2018, I moved to Australia, which means that it took 2 years time waiting period for me for 2 years. And after that, I moved to Australia. After moving to Australia, then I started my internship in 2019. And after completing my internship, I started working as a clinical pharmacist in the hospitals. But as my visa was temporary residence, the TR, okay, I had to be in regional areas, okay, in regional Australia for 3 to 4 years. So where I served in the regional area. And then I moved to Melbourne in Jan 2023. Okay. So this is my journey. So which means that for every person, those whoever they are planning for these countries, that is the Western countries, so we need to have some sort of the patience, then we will get these visas and so on. But otherwise, the other options are, so you can take the student visa but when you are going with the student option, select those courses. There are many courses which will, like, you can pay only $30,000 to $35,000 within $35,000. So you can finish complete your 2 years program, and after 2 years, then they will give 2 more years post study visa. That is 4 years you can stay in Australia, and in these 4 years you will complete your internship, you will become a fully licensed pharmacist, okay? And also you will find out some options to get the PR, okay? Because you will have 4 years time with you, okay? So in 4 years, it's easy to do any sort of those things, okay?
Yes, sir. Here we have another question about, should I continue pursuing my master's degree or should I take the licensure exam?
Like it's up to you. Like, for example, if you are doing the master's in clinical pharmacy in Australia, Or not only in Australia, I'm not only talking here only about Australia, but even in Canada or in Ireland or in UK or in US. So to get your degree, master's degree get recognized, to get your master's degree get recognized in these countries, in those countries, you must do your master's only in clinical pharmacy. Okay. So for instance, if you do masters in some other courses, like in some other branches, like in public health or in any other courses, then your like qualification, it won't be considered. Okay? So in case if you do the masters, then your qualification will get recognized. Masters in clinical pharmacy, then your qualification will get recognized, and then you will like you need not to sit for the first part of the licensing examination in Australia, but still you need to do the internship. You also need to sit for 2 more exams. That is the intern pharmacist written exam and intern pharmacist oral examination in Australia. So the same thing goes even in Ireland. If you are targeting Ireland, then you must do the masters in pharmacy in Ireland, not in any other courses. Because right now we started the Ireland program, training for the Ireland program, and also we have teaching for the PBC. Okay. So there were many students with us in PBC batch, as well as right now the Ireland students also, they have enrolled with us. Okay. So they were doing the masters in some other courses. Okay. So which means that their course won't get recognized. Okay? The course won't get recognized. So that's why they are sitting for this examination pathway. Okay. So the best thing, if you are doing masters in clinical pharmacy, which is a highly expensive course, then you can continue it. Okay? But if you are doing masters in some other courses, then that is not a best option to continue it. So you better go with the examination pathway. So which costs you only like around 4,000 Australian dollars to complete all the steps. Okay. So within 4,000, you will finish all the steps and you will get your license. But to do masters in clinical pharmacy, to do the masters in clinical pharmacy in Australia, it will cost around, it depends on universities. If you want to do the masters in clinical pharmacy, 2 years program in Monash, then it will go up to 100,000. That is 1 lakh 1 lakh Australian dollars. Okay. So that is highly expensive. Compare $4,000 with $1 lakh. Okay. So there is a huge difference.
So there is one more question: how to become a successful pharmacist in Canada from India?
To become a pharmacist in Canada, again, like Canada pathway is completely different when compared to Australian pathway. Okay. So in Australia or New Zealand, if you want to become a pharmacist, at first you need to clear the first part of the exam, that is OPRA exam. After clearing the first part of the exam, OPRA exam, you must start doing your internship. You must, that is a mandatory. So you must start doing your internship for 1,575 hours. Like you need to do the supervised practice for 1,575 hours. And during this internship, after you complete like 75% of the intern hours, you will be eligible to sit for the next 2 exams, like intern pharmacist written exam and the OSCE based, like oral examination. Okay. So this is the process for Australia, which means that after clearing the first exam, the next step is we must enroll in the internship and we must start doing the internship. Then only we can clear those 2 exams. After clearing those 2 exams and once we finish the 1,575 hours of intern practice, then we will be eligible to get our final full license to practice in Australia. The same goes with New Zealand as well. So at first we need to start doing the internship. But when it comes to Canada, in Canada, the process is completely different. In Canada, after you complete your first part of the exam, that is evaluating exam. Evaluating exam is nothing but that's the common exam for all the overseas pharmacists. That is the common screening exam. Okay. After you clear the evaluating exam, then the next step will be qualifying exams. Okay. So qualifying exam, again, 2 parts, like part A and part B. So part A of qualifying examination, or the part 1 of qualifying examination, will be MCQ based. Okay. So they will provide you the case scenarios, and again, there will be 4 options. So you need to select the correct answer. It is also a computer based exam. Okay. And part 2 of qualifying examination is nothing but OSCE. Okay, so you need to directly, you need to face-to-face, you need to attend the OSCE exam and clear that OSCE part. Okay, so here in Canada, there is no certain condition that in order to sit for the part, in order to sit for the qualifying examination, at first you need to do certain hours of internship. Okay, so there is no such criteria. So for Canada, like for example, if today you clear your evaluating exam, that is the first exam, okay, the next month itself, if the slots are available, you can book your qualifying examination, both part A and part B. Okay, that is MCQ exam as well as OSCE exam. That is back to back. You can clear all the 3 exams. So when once you clear all the 3 exams, then you will get the certificate. You will get the PBC certificate. Okay? So that certificate, okay, after you get that certificate, then the next step, what you need to do is, there are certain provinces. Okay, so there are only few certain provinces like British Columbia and other things. So they will ask you to go for bridging courses, but other provinces, they don't ask for to go for any bridging course. Okay? And this bridging course is also completely depends on if you can clear the exam, that is evaluating, especially qualifying examination MCQ and qualifying examination OSCE within the first sitting without any failure. If you can clear, able to successfully, if you clear the exam in your first sitting, then you need not to go for any bridging course. But if you fail that exam, okay, in the first sitting, if you fail the exam, then you need to go for the bridging course. So the bridging course will cost you around 14,000 Canadian dollars, or it depends on different provinces. Okay, so it will be 10,000, 14,000, or there are in some provinces it is $6,000 as well. Okay? So it is like just like a punishment. Okay, so if we can clear successfully, if we clear the exam in the first attempt, then no bridging course, no need to pay the fees and nothing. Okay, but if you fail in the first attempt, then there is a punishment that you need to spend time to do the bridging course. That is 6 months to 1 year time, and that bridging course will cost you around 10,000, 14,000, 18,000 Canadian dollars. Okay? But anyhow, if you prepare well for the exams, if you clear the first part, evaluating, and then the second part, qualifying exam, you will get your PBC exam board certificate. And the next step, what you need to do is just you need to clear your IELTS or TOEFL, like, or OET, occupational English language test. That is the English test. And when once you clear that English test, then you need to sit for one more exam. That is the ethics exam. Ethics exam will be quite simple and easy one. It's an open book exam. So you need to clear that exam. And when once you clear that exam, then you will get your full license in Canada. Okay. Some provinces, they will ask you to do the observationship, that is the internship or supervised practice, only for 300 hours, or for some provinces, they have up to 500 hours. Okay. But in Australia, it is 1,575 hours. 1,575 hours means almost it will take 1 year time internship. But in Canada, if you clear the exams back to back, okay, that is, if you have prepared well, if you book the exams and you have cleared the exams back to back, so within 4 months, you will get the license in Canada. Okay. So this is the huge difference between Canada and Australian licensing examinations. The same goes with the Ireland as well. Even in Ireland, it is easy because now in Ireland, right now, so there is no more internship or supervised practice or the observation ship. Okay, so they have completely removed. Okay, so only like just you need to clear the first part of the exam, that is the MCQ exam. Then you will go to the second part of the exam where you will be having the OSCE. So the OSCE will be of 2 types. One is the written OSCE and the oral, that is direct face-to-face OSCE. So when once you clear these exams, then you will get the license there in Ireland.
Yes, sir. There is one more question.
Yeah.
What are the job opportunities for PharmD in New Zealand?
Job opportunities for PharmD in New Zealand. Okay, so well, whatever be the country that you select, okay, either you select Australia or Canada or New Zealand, okay, or Ireland, the job opportunities will remain the same. Okay, so I can say that opportunities in the sense, like it completely depends on your license. Okay, so if you have gained your license, okay, that is the pharmacist license, full license. I'm talking about the full license. So if you have gained the full license, then definitely as you are a Form D candidate. Okay, so which means that here the main opportunity means even a bachelor of pharmacy will become a pharmacist in New Zealand, and even a Form D can also become a pharmacist in New Zealand. The same goes in all the countries except in US. Okay? Now even Ireland is also accepting the bachelors. Okay? So even a bachelor of pharmacy can also become a pharmacist, and Form D can also become a pharmacist. Then where does the difference it comes? Where, like, what is the difference between a bachelor of pharmacy and the Form D candidate, or those who have the masters and those who have only the bachelor of pharmacy? So the main difference it comes when they are applying for higher positions, okay? Especially if you are planning for clinical pharmacist positions in the hospitals. Okay? So when you are applying for the clinical pharmacist positions in the hospitals, then all over the world, they know that what is Form D, okay? And they know that how the program it will be. Okay, so it is a 6 years program, and they know that in during this 6 years program, they will have a very good exposure. They will be going to the ward rounds, and also they will be doing their internship and so on. Okay, so it's a known fact. Okay? So which means that when you apply, like if there is one position, assume that there are 50 applications. If they come, then they will sort out all the applications. Okay? So when they sort out all the applications, then they will pick those applications which are highly potential applications. Okay, so if they want to call 4 members for the interview, then they will pick only those 4 potential applications. During that time, what they will do is they will put all the Bachelor of Pharmacy candidates applications aside, and they will mainly pick the masters, those who have the masters or those who have done the Form D. Okay? And not only doing these programs, but at the same time, you also need to have some clinical experience. Okay? So if you have the clinical experience and everything, that if your resume is strong enough, okay, then easily they will pick your application and they will call you for the internship. Sorry, for the interview.
So we are also joined with Ninad Prajapati, our expert member with us today, and I would like to call him for his insights. Ninad is someone who has cleared his OPRA and he is based in Australia and is continuing his pharmacy. So Ninad, welcome.
Hi, hi, thank you so much for inviting me. I'm glad
Hi
to be the
Ninad,
part
how are
of the
you?
interview. Hi, sir, nice to see you. I did my interview with the ma'am, and I just conveyed, I just said her, like, please convey my thanks. Thank you so much for your guidance, sir. It was easy with your guidance to clear the clinical part. And I would like to thank you so much for helping me out for the opera. Thank you so much
Yes,
for that,
thanks,
sir.
thanks Ninad. Yeah, thank you so much.
Yep. Hi, Ashutosh. How can I help?
Yes, yes. So we have a few questions for you too, Ninad. The questions are like, how did you know about Allied Expertise? How did you get in touch with Allied Expertise? And how did you complete your opera journey? What was it like?
Okay, so I start with my name first. My name is Nath Prajapati, and I was the part for the Elite Expertise in the OPRA, the March 1 exam. Like I'm doing my Masters of Pharmacy here in the University of Canberra. I one day I came across the YouTube advertisement of Elite Expertise, and I was aware about what's the opera exam is, and I'm doing my master's as well, so I know what are the opportunities after that as well. So just one day coming like across the advertisement, and I decided to start my opera examination and want to see that where I do I stand for the examination. And with the grace of God and with the help of sir and ma'am, it was easy to clear the examination, and I cleared it in the March 2025, I guess. Yeah, this first opera examination. So yeah, that was all about the Elite Expertise journey. The unwavering support from Ashutosh Elite, because I know him personally. I joined it through him only, and with Ashrita is there, and every team member was also very supportive with the logins and credential details. And talking about the lectures from sir and ma'am are the best, because they have provided each and every detail for every clinical, or either it's pharmacokinetic or it's any of the part of the pharmaceutical exam in Australia, that is OPRA. They have provided every information with mocks, and their best, I would say, was the materials, the handouts they provided with the calculations, and all that turns out to be very much helpful in the examination journey. And results came out to be in the favor of the students. Many of them have cleared the OPRA examination of like by the elite expertise only. So I would like to thank again for Arief sir and Harika ma'am for providing us this beautiful journey to clear our examination. Thank you for that, sir.
Thank
Ninad,
you
there is
so much.
one question for you.
Yeah.
How did you clear your examination in the very first attempt?
So like for me, my journey was a bit different from other because I'm already here in Australia. I'm working in a pharmacy as a student pharmacist. So I know the regulations, the rules, and the practices over here. I'm doing my master's as well, so was a bit aware about the examination. But for the opera, how the examination is and what are the course material was totally different for me. It was new to me, and Arif and Harika ma'am has helped us with everything. They provided us the every knowledge. Their lectures are so informative. I wasn't able to attend the lecture in person, but I used to do the recordings. But I guess like if you do the lectures and if you do the practice the mocks and if you focus more on the like the handouts at the end of the examination will be very much helpful to clear the examination in first attempt itself, just like I did, and many of the elite expertise students has did it before as well. So all the upcoming students or all the like aspiring pharmacists overseas who want to practice in Australia can definitely easily can clear the opera examination. It is not similar as KAPS, I don't know, but it is definitely easy if you learn and if you know how to that apply the knowledge in the examination. It would be easy for everyone.
Thanks for
Thanks.
that, Nihat. So I have a, small question to you.
Yeah,
Like as
sir.
already, yeah, as already you are here in Australia and you are doing your masters in Canberra in
Yeah,
University.
yeah.
So what made you to like select this licensing pathway? Because this is what that most of the candidates, those who are back in India, so they might be thinking that, so what they need to do now, like they will be finishing after they finish their PharmD or after they finish their Bachelor of Pharmacy, or even those who have done the masters in India or in any of countries all over the world. So they might be thinking to move to Australia, Canada, or any of these countries, and they uh, want to pursue their masters here. Okay, so what is the opportunity like after doing the masters? So without clearing this licensing examination, what is the what is the
Opportunity.
opportunities and so on?
Yep, sir. So like I'm so small to answer that question to you because you everyone like you already know all the stuff. But I would like to just highlight few of the things. Like even if you do the Masters of Pharmacy here in Australia, in like there is seven state universities, and they are only they are the only universities who are providing the Masters of Pharmacy course. They are also eligible to get the same internship without doing any of the OPRA examination, any of the licensing examination. They can start they can kickstart their internship straight away after their master's degree. And like if we talk about the internship, like everyone is struggling for finding an internship. So for master students it's bit easy because you're already being aware about the Australian system, and while studying you are already working in a pharmacy in either way of doing placements or either in a way of doing your part-time job, so that it's become easy for every of the students who is doing masters in pharmacy, not pharmaceutical science which is in Monash, or not any of the other pharmacy courses. Just masters of pharmacy will lead you to direct internship, and then you can apply for 190 pathway straight away of this 6 year, like you as you already mentioned, 6 months of the permanent job residency. So that is the thing. Talking about my side, sir, for doing it like in the licensing way. So
Mm.
for me, as I said, like it was always opportunity to do it in a different way. So I did it, and luckily I cleared the exam, because both of them is gonna giving me the same opportunity. But I want to see that where do I stand, and I just took this pathway. And there are some more things that's coming up with the Ellight Expertise in future as well, so I can't reveal much over here. But I would like to suggest everyone, like, if you want to become a registered pharmacist in Australia, and if you're already cleared, try to come with any of the course, like if you take even MBA or even any cheap courses, as you sir already mentioned, to get into the Australia, to kickstart your internship. Because what happened is that I see one of the question from Gaurav, like he has got 80 points, but he is not getting invitation for regional Australia as well. So Gaurav, your answer I can give is that due to like there are n numbers of the application which is pending from the immigration side. Even the pharmacists over here, like pharmacists over here, are not very much interested in the overseas candidate initially, because they already have some of the very bright candidates who are already doing their masters, or the Australians who are very much eligible for the same internship. So that's why we are getting delayed for the same stuff. So yeah, that's how you can kickstart your journey. If you have some financial freedom, try to come to Australia, get it into the pharmacy, take as an assistant position or dispensing, like dispenser, any of the thing, and kickstart your journey by doing that one. It would be very easy for you as well.
And Nina, one more thing, like as you mentioned that you are already working as a pharmacy assistant in one of the pharmacies.
No, sir, I'm working as a student pharmacist. Sorry, sir.
As a student pharmacist.
Yeah, so I'm a student pharmacist over here. So like my title is that only because I'm already doing my student masters, so that's why they titled me as a student pharmacist. Yeah.
Okay, sure.
Yeah.
So which means that it gives a very good exposure to you, like by doing a student pharmacist, means you will be spending your time in the dispensary along with the pharmacist.
Yeah.
So which means that the time when you start your internship journey, okay, it becomes much easier for you to do those things.
Yeah, exactly, sir. Yeah, that's true, sir. Like even my pharmacist is very happy to have me as an intern, so I am very much happy to kickstart my journey next year. But yeah, that you are definitely right, sir. It becomes very easy when you work in a pharmacy, because you are very much aware about everything. And to be honest, if I talk about Canberra, we are very lucky to have very nice pharmacies over here, and like there are some of the best pharmacies. Yeah. So if someone wants to come to ACT regional, please come. It is the best place to kickstart your journey. Either you go for regional, just like the Arief sir, go for Victoria, the Melbourne one, but you can definitely try Canberra as well.
Canberra as well. Yeah, it's also a very good place. Yeah.
Thank you, sir.
Yeah. Thanks, Ninat. And Ashutosh, do you have any questions?
Yes, sir. Yes, sir. We do have questions. There is this technical question. If we go for MSc Pharmaceutical Science program in Ireland and also appeared for registration exam in Ireland, then we have two options. One is clinical pharmacy, other industrial. Is it a good option? What about doing MSc Pharmaceutical Science in Ireland?
So if you do the MSc in pharmaceutical sciences, like the option is like as I have mentioned that if you do it only in the pharmaceutical sciences, okay, MSc in pharmaceutical sciences, then the main challenge here is the fee. The fee will be a bit expensive, okay. But ultimately, like in case if you are happy to bear that fee, and if you are happy to spend that amount, okay, then like the main thing is that when once you complete your course, especially you check your course, okay. So because I'm not sure how the universities that they offer there, so your course or your program should give the NFQ equivalency of 9, then only you will be eligible to practice up over there in Ireland, okay. So but if it doesn't use the NFQ level 9, if you still stand at NFQ level 8, which means that you need to again go through the examinations, and you need to clear the exams, and by clearing these exams, then your profile will stand at NFQ level 9. And when it comes to industrial side as well as the clinical side, okay, so it depends completely upon your own choice. Even I can share a few things, like in Australia, even in Australia, like some, they might be interested in going in the industrial side, especially in the clinical research side, okay? Or some of them, they want to become a pharmacist, like the clinical pharmacist. So in both the pathways, like pay-wise, I'm talking about the pay-wise, both are very good, okay? But clinical research, if you want to go to the industry, either the clinical research or pharmacovigilance or any other part, because in these countries the manufacturing will be very less, okay? So you won't find much opportunities in the manufacturing, but you will find very good opportunities in clinical research, okay? As well as in pharmacovigilance and other sectors, okay? So the problem here is, like, I have seen a lot of candidates in clinical research, especially those who are working in the clinical research. So there will be two types of the titles in clinical research. One is the normal CRO position, clinical research, and the other one is the clinical research pharmacist position. Okay? So there is a huge difference between these two positions. So those who are doing just the normal clinical research jobs, so anyone can enter into it. Okay? So any BSc, Bachelor of Science, are eligible to enter into this program, and they can start earning the money up to 80K or up to 90K. Okay? But if the designation is specially clinical research pharmacist, if it is the clinical research pharmacist, then for them the position will be completely different, okay? The grade level will be completely different, okay? So for them the starting pay will start from 120K and it will keep on going up to 150, 160. So I know right now there are a few of my friends who are getting up to 170K per annum. Okay, so that's the difference here. So the ultimate thing is that we need to have the license. Okay, so if we have the license, then our value, even if we go to the industry side, okay, then we still have a higher position. We can still get the higher positions even at the industrial side, okay, along with the license and some sort of the experience.
Yes, sir. There is one more question. How does the pharmacy work environment differ compared to my home country?
Pharmacy work environment, in the sense, especially I can say that like I'm comparing with home country in the sense, because I'm from India, so I'm comparing from Indian practice to Australian practice or Canadian practice or any of these Western countries practice. So I can say that when it comes to the practice, okay, there will be a huge difference. It arises, okay? Because here in these countries, like, will follow the strict guidelines and all those things. So the regulations will be very much strict, and everything, like everything, there will be a standardized thing. Okay? Even if you are working in the community pharmacy, then once the patients, any patients, when they come to the pharmacy and if they ask for any of the even for the normal over-the-counter medications, so we don't just keep on giving the medication to them. Okay? So we will ask them, we will take the complete history of the patient, like what happened. Okay? So why, like for example, if a patient comes to the pharmacy with a headache, okay? So we will ask all the appropriate questions to the patient. Then we need to, as a pharmacist, because we are the healthcare professionals and we are the first professionals, easily accessible professionals to the patients. Because in case if they want to go and see the doctor, so they need to get the appointment and then they need to go and visit the doctor, so which will be a bit challenging for most of the patients. But they can come to the pharmacy, pharmacists will be available, so they can get a free advice from the pharmacist. Okay? So that's why a pharmacist is considered as a first line professional in all these countries. So once the patient, they come to the pharmacy and they say that they have the headache, just simply we don't give any Panadol or the Nurofen tablets to the patient. Okay? So we'll take the complete history of the patient, what happened, why the patient is getting this the headache, okay? And like we need to make a differential diagnosis, what type of headache it is, whether it is a tension type of headache or a migraine attack. Okay? So those things are the ones that we must do, and then if required we need to refer them to the doctor. Okay? But if not, if it is within the scope of pharmacy practice, then we can give some medications and the further advice to the patient. Okay? So in this way, there is a huge difference between the practice when it comes to back to our home countries where we have studied and so on.
Yes, sir. There is one related question that are pharmacists allowed to prescribe or modify therapy under collaborative agreements?
Yeah. So prescribing rights are there in Canada. In Canada, the pharmacists, they are allowed to prescribe the medications. Even in Australia, right now, they have introduced the prescribing rights for pharmacists. Okay, but remember, prescribing in the sense we can't prescribe any new things. Okay, so for instance, if the patient is already having the blood pressure issue, okay, and if the patient ran out of the script for his blood pressure tablets, okay, then in that situation, a pharmacist can help the patient. Okay, so by giving 1 month supply. Yeah, so by providing 1 month supply, or there are some for certain things in Australia, straight away they have introduced the prescribing rights for the pharmacists, especially for UTI problems. So nowadays we are giving the UTI trimethoprim antibiotic, the medication to the patient. So those things are already there, okay, and we have been practicing those things. Okay, so they are the prescribing rights. But again, as when it comes to the prescribing rights, so we pharmacists are not in the position to make any new diagnosis. Okay, so in case if already the patient has been taking the regular diabetic medications or the blood pressure tablets, and in case if they have run out of the medication, then we can do a collaborative management plan with the doctors. Okay? So whenever we do any prescribing to the patient, then we'll send a email to the doctor by mentioning so and so things, and it becomes a collaborative thing.
There is another question. Can I work
Yeah.
while waiting for full registration?
Sorry, Ashutosh, can you please repeat?
Can I work while waiting for full registration?
Yeah, you can work as an intern pharmacist. Okay, so like for full registration is to get the full license in Australia. But when once you clear the OPRA exam, the first part of the exam, then you will start doing your internship. Okay? And this OPRA exam is common for both Australia and New Zealand. Okay, so by clearing this OPRA exam, you can become a pharmacist either in Australia or you can become a pharmacist in New Zealand. But there will be a minor differences, those things that you need to fulfill, like English language requirement will be different in New Zealand when compared to Australia. Okay, so those are the things that we need to fulfill, and then after clearing this exam, then you will start doing your internship, and during internship you will start earning around $27 to $30 per hour. Okay, so that's the pay rate for intern pharmacists at the moment. So you will start earning your money by when you enroll in the internship. Okay? So even in other countries like in Canada and in Ireland, so even in those countries, like when once you clear your exams and get the license, okay, then immediately you can start practicing as a pharmacist there.
Yeah, so there is this question. What are typical pharmacy work hours? Are night shifts common?
Yeah, of course. Like the typical hours will be like most of the pharmacists, they will be doing the daytime shifts. Okay? Like all the pharmacists, most of the pharmacists in Australia, so they will start at 8 o'clock in the morning, or some pharmacists they will start at 8:30 in the morning. Okay, so they will close at 5:30, 6. But there are some pharmacies they are open till 11 o'clock. Okay? So most of the chemist warehouse they are open till 11 p.m. Okay? And which means that like there will be those who do the shift in the morning, that is during the daytime. Okay, so they will get the normal pay rate, but those who do the shift, especially the evening shift, okay, if they start at 3 p.m. and if they work till 11 o'clock, okay, then they will get the extra loading hours. Okay, so they will get the extra pay for doing that night shift. Okay? So in a similar way, even in the hospitals, like we do have the late shifts. Okay? So those whoever they do the late shifts, then for them the extra hours or the extra pay will be provided to them.
Yes, sir, there is this question. Can I switch between hospital and community easily?
Easily in the sense, like for example, if you are working in the community, then to switch into the hospital, like you need to face a lot of interviews. Okay? But if you are working in the hospital and if you want to go back into community, always community, the doors will be opened. Okay? So it is easy to get the job in community. Okay? And but it will be a bit difficult to get the jobs in the hospitals because of the limited hospitals in Australia, Canada, even in Canada, the same situation, US, the same situation, Ireland, the same situation. Okay. So the main opportunities that we can get will be in the community pharmacies. Okay. Um, but to grab the job in hospitals, you need to stand out. Your profile should stand out with good clinical experience and with if your profile is higher, then then they will call you for the interview. Even in the interview, there will be many rounds. Okay, at least 2 rounds or 3 rounds will be there, and the panel members will be there. So the selection team. So like it will be like just like a corporate interviews. Okay.
Yes, sir. There is this last question. I guess this is a repetitive one. Here's someone asking, what is preferable, MSc in clinical research or pharmaceutical science? Kindly guide us.
If you do the MSc in clinical research, okay, then the only opportunity is you need to find the job only in the clinical research field. Okay? So you can never become a pharmacist. If you do the MSc in clinical research, then you need to go only in the clinical research field. And as I clearly mentioned that if you are a pharmacist degree holder, okay, and if you want to enter into the clinical research, as that's a good option. Okay, but enter into the clinical research by holding the pharmacist license. If you hold the pharmacist license and if you enter into the clinical research, then as I mentioned that there will be a position that is known as the clinical research pharmacist position. Okay, so if you just do the job as a clinical research um, uh, as a CRO in any one of the companies, then your pay rate will be only around 80,000 Australian dollars per annum. 80 to hardly it will go up to 90,000 per annum. But if you get the clinical research pharmacist position, only limited candidates will be there in that position. So that's why if you already have a very good clinical research experience, and if you are a pharmacist, then easily you can reach to that level where the pay rate will be very higher. So if you, as your question is to do MSc in clinical research or to do the MSc in clinical pharmacy. Okay? So I recommend if you want to become a pharmacist, okay, and get the license in Australia, so clinical pharmacist will be the best option. But again, the fees will be very high, okay, to do the MSc in clinical pharmacy. And as Ninad also clearly mentioned, the best thing is that what you need to do is if you are aiming to move to Australia and to settle here in Australia, okay, so ultimately what you need to do is you need to select any program, it doesn't matter. Okay, so 2 years program, master's program, any program, it doesn't matter, but select from that those universities which offer at a lower price. Okay, so you can select any of the universities that they offer at the lower price, and you come here, you do your program, and at the same time clear your exams, licensing exam. So by the time when you clear the licensing examination, what happens is, so here you will be going to uni only for 3 days, and the rest of the days you can do like you can the rest of the 4 days you can work. That is, you are entitled officially, you will be entitled for 24 hours to do the part-time job. Okay, so where you can keep on doing your part-time internship and complete your internship, and by then you will get your pharmacist license, and also it will be much cheaper to finish your masters here.
Yes, so we have one more final question. Is OPRA easier than PEBC?
Of course, OPRA is a bit easier when compared to the PBC. Okay, but PBC, as I mentioned, that advantages. Okay, so if you work hard and if you can clear this PBC examination, like as there were many students, those who are getting trained with me under PBC. So they have shared me the document, like uh, they are getting the offer letters. They are getting the offer letters from the employers for 2026. for 2026, that is for next year. Okay? So right now they got the offer letter. Okay? So in that offer letter, clearly they mentioned that by June 2026, if you can clear all the examinations and if you get the license, okay, then we are happy to sponsor you to get the PR in Canada. Okay, so that's the offer letters that 3 students right now they have that offer letters, okay, with us. Those who are doing the PVC training program with us. Okay, so they are studying for the exams. So which means that even before appearing for the first part of the exam, even before appearing for the first part of the exam, the employers, they are happy to give the offer letter to the candidates. Okay? So which means that definitely you will get the options in Canada. Okay? So these are like, there are certain pros and cons. Okay? So what will be the country that you want to select? Like both the countries are good for pharmacists to practice as a clinical pharmacist over there.
Yes, sir. It was supposed to be the last question, but there is one more question from Dhwani, and she's asking, could you please tell me how much time and hard work it usually takes to get ready for it, and what area should I focus on the most?
Like the thing is that if you have a proper, like when it comes to the exam preparations, okay, so as at the beginning itself I told you guys, when I was doing my internship back in 2019, so I told you that along with me there were 4 pharmacy assistants who were working in that same pharmacy, and they mentioned that they have appeared for that exam, KAPS exam, during those days, like even last year, till last year it was KAPS exam. So they appeared for that exam, they have failed that exam. So one of the candidates, he appeared that exam for 4 attempts. He made 4 attempts and he failed that exam 4 times, which means that he has been sitting for that exam for 2 years, but till then he hasn't cleared that exam. So it depends on how we are preparing. Okay, so for any exam for any country, okay, so Canada, at first we need to know, we must go through the blueprint, examination blueprint, okay, and we must know that what are the important things that are required and how we need to prepare for the Canadian licensing exam. Okay. And when we are preparing for the Australian licensing examination, again we need to go through the blueprint and we must know where, in which areas that we must stress. Okay. And same thing with NAPLEX, same thing with Ireland. So any country that you are planning to, you must have, like you must have that knowledge that where, in which area that you need to stress to clear this examination. Okay, and if you don't have a proper planning, if you don't have the good knowledge that where you need to study and which component is much important for the examinations, and which areas that the examiners they will stress more. Okay? So it takes like some, for few candidates, like it may take up to 3 years or 4 years time just to clear these exams. Okay, so but in case if you know well about, this is the section exactly from, this is the part where we get the questions, gunshot questions in the final examination, then just 2 months preparation is enough. Okay, 2 months preparation is enough. Okay, so most of our students, whoever they have cleared the examination, that is Australian OPRA examination, so they did the preparation only for hardly around 2 months or 3 months. Okay, so but 2 to 3 months I recommend them to focus completely on the exam. Okay, so that's the most important one. So when you are spending the 2 months, put everything aside and focus only on the examination, and you give 2 months time for us, and it is our responsibility to make sure that you crack your exam of your dream country, whatever be the country that you are planning for.
Thank you, so thank you for your awesome insights, and thank you for all your guidance. I hope everyone has understood it and they have got their queries resolved. So it's time, and everyone who is present here can please take out some time and go through the feedback form that we have in the chat box. You can give feedback about this webinar and all that, the discussions that we have today. Thank you so much. Thank you, everyone. Thank you for being such a wonderful audiences.
And
thank you.
Just a last thing from me. So I would like to thank all the participants so for attending this session, and I hope that I tried my best to answer most of your queries. Okay? But still, if you have any questions, please don't hesitate. You can message to our team members. Okay, so our team members will help to like answer all the questions that you have. Okay, so in case if they couldn't able to answer, then they will bring that question to me and I will answer it to you. Okay, so thanks for joining, guys. And as I mentioned that, please don't hesitate. So whatever be the questions that you have, you can just come up and you can ask to our team members at Ellight Expertise. Okay, and please don't forget to subscribe Ellight Expertise YouTube channel, as well as follow us on my personal LinkedIn. Okay, and also on our Instagram and Facebook. Okay, thank you so much. Thanks for attending this session.
Yes, thank you, everyone. You can see the numbers flashing in the chat box. You can connect us through those numbers. Thank you.